Test 1 2 3. Test 1 2 3.
Y'all ready? Okay, good morning. It's early, so sorry about the early time. The board has some things to take care of this afternoon as far as board training, so it's not to eat our whole afternoon. We're starting a little bit early this morning, so thank you all for being here. We'll call this meeting to order at 9:09, and Happy New Year. It's good to see everybody this morning. We've got some business to take care of. First off, we will start with Angela McDonald, who will do our invocation.
Opportunity to gather in unity. We thank you for this day and the purpose of this meeting. We ask for your guidance and wisdom as we discuss the matters at hand. Grant us the clarity of thought and the compassion of heart to make decisions that honor you and benefit everyone that we serve. May your presence be felt among us throughout this meeting, guiding our words and actions. In your name we pray, amen.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. A little bit of business to take care of here and getting some swearing in for the new year, new board officers. Amanda, DT, if you could join me here at the flag. Trent, you have the script. We'll get this taken care of real quick.
I do this today, I would have worn a tie. Dorothy didn't give me any advance notice. So, congratulations to all of you. If you'll raise your right hand and repeat the oath of office. I state your name.
I, Roger Fisher,
Do solemnly swear and affirm
do solemnly swear and affirm
that I will faithfully execute the duties of the office or position to which I've been elected
that I will faithfully execute the duties of the office of which I was elected
by the Board of Managers of the Tarrant County Hospital District,
by the Board of Managers of the Tarrant County Hospital District,
a political subdivision of the state of Texas,
a political subdivision of the state of Texas,
and I will, to the best of my ability,
and I will, to the best of my ability,
carry out such duties
carry out such duties
in a manner consistent with the Tarrant County Hospital District bylaws
in a manner consistent with the Tarrant County Hospital District
and the laws of this state and the United States.
and the laws of this state and the United States.
So help me God.
So help me God.
Congratulations, Steve.
I think they are running. I was making sure to get that info.
Well, thank you. I'm going to take just a second here. We've got some new, as far as the finance and planning, we've got some new members at the table, and we welcome you all here. And I want to thank each of you board of members and tell you what an honor it is to serve as chair of the JPS Board of Managers. Serving alongside some of Tarrant County's best citizens is an honor. Many past chairs of this board continue to serve our county. Dorothy Bowes, Reverend Emerson, Trent Petty. I am grateful to count on each of you and your collective wisdom and friendship. It's funny, in 2015, County Commissioner Fickus called me to make sure I was at coffee with the commissioner at the HEB Chamber of Commerce. He had something important he needed to talk to me about. I had no idea what he wanted. Little did I know he was committing me to a life sentence at JPS Hospital. There are days I sit back and think, what did I do to make Commissioner Fickus so mad? I'm only kidding. I am grateful to Commissioner Fickus and the Commissioner's Court for allowing me this privilege. Everyone at this table knows that a serious time commitment comes with membership to this board. Our shared service is only possible with our families, coworkers, and client support. At some point, each of those will suffer during our service, but they do so because they know our mission is noble. I want to thank my wife and our kids for allowing me the time necessary to complete our work. And I also want to thank my team at my office who will take the brunt of the damage while filling in for me while I'm up here. And based on the last 2 weeks, it's clear that Dorothy did not tell me the truth about the time commitment as being board chair. At the holiday party, the most common question asked was, "Are you ready for this?" And my answer was a quick, "I don't know." And it's because I wasn't sure. But I said at the time that with this board and this administrative team and the more than thousands of people that work for JPS, I am confident that we are ready for anything. And I meant that. This board is collaborative, accessible, and active. We're not always unanimous in our decision making, and it's okay. In fact, it's healthy. It shows we're a healthy board. As we go into the new year, I ask that this board remains committed to the mission of JPS Health Network. And always remember that you're not only a political appointee, but a fiduciary to this hospital system. And your responsibility is a great one. I look forward to working with each of you as we strengthen this health system. As new facilities rise out of the dirt, we maintain our promise to county taxpayers to build the facilities responsibly, as these facilities are the foundation of the future of healthcare in Tarrant County. And I've said for a long time, JPS has a story to tell, and this board will make sure it gets told. I want to be clear that this is a health network for all Tarrant County residents, young and old, rich and poor, housed and homeless, and yes, even those that come in bright colored uniforms. Finally, I would like this hospital system to leverage every relationship, whether it be business, academic, research, private-public partnership, or philanthropy, to improve our outstanding services here. Together with these partnerships, we are more robust at addressing social determinants of health, and these relationships will raise the bar for community health and allow us to continue bringing everything that JPS has to offer to the community. So I'm excited for this new year, this new term, and the direction in which we're about to go. So thank you all for the opportunity. Thank you. I'm already getting help here, so this is good. So I want to first ask if there's any citizens wishing to address the board today. None have signed in, so we're good. Item 5 is we'll call for approval of the minutes of the Joint Board of Managers and Finance Planning Investment Committee meeting of December 14th. Those, Zim with motion to approve, Dr. Emerson for the second. All in favor? Any opposed? All right, great. Dr. Duncan?
Yes, good morning and Happy New Year's to everyone. Welcome, Chairman Fisher. Does that sound good? It does. Welcome, Dr. Davis, Dr. Fowler, and Dr. Casey. We are more than happy to have you join us on this board. Chairman Fisher, I'm not sure if Dorothy shared with you what it means to be in the hot seat between this CEO and between this Chief Legal Officer of JPS. Do not believe everything that she has told you. I just want to reassure you that we are here to support you. We are kind and we are helpful as long as you do what we say.
Okay.
No comment, Mr. Petty. But welcome. Yes, it was cold here. Our buildings are old, and they were stressed during this frigid temperature. I received videos, and I actually sent one to Roger, of pipes that are exposed in our old building, and that actually did undergo some leaking and probably rupture on a greater level. But our JPS team, our facility team, is amazing in quickly responding and getting the restoration team in here and keeping operations going. So I want to thank our facilities team. I also would like to thank our JPS team members who came in, who stayed overnight to ensure that we would have staff here, that include our providers, but we would have staff here to care for our patients. And so again, an amazing JPS team that I want to recognize. For those of you who may not have listened in on Commissioner's Court last week, Judge O'Hare recognized our Level 1 trauma team as being one of the top Level 1 trauma teams to receive those who were injured in the hotel explosion. And he thanked JPS for the great care that they provide to the 7 individuals who were transported here. I heard yesterday at Med Exec Committee Dr. Miller say that within minutes of receiving the call that there had been an explosion, they were ready to receive 20 injured individuals. Just think about that. As we are operating to be able to be that adaptable, flexible, and resilient to get ready for 20. We received 7. We received the most critically injured patient here that we stabilized and sent to our great partner in Dallas, Parkland Hospital, to their burn unit, who continues to recover there. We have discharged all of the other injured individuals home. And so again, thanks to a great JPS team and being ready when the community needs us. Not only were we recognized by our court, but darn if we didn't get recognized by U.S. News and World Report for being the best hospital in Texas. Oh my God. Being one of the best hospitals in Texas. I am so proud. I am so proud. We were, and I don't know if we have, yeah, so here you can see we were rated high performing in 7 of our adult procedures and conditions. So great way to be recognized, not only here locally, but also nationally. Okay, so let's get loud. Our next one here. We are JPS proud for our great work that we are doing here at JPS. You can see here that we continue to advance our quality of care, again, by being recognized as one of the top hospitals in Texas by U.S. News and World Report. We have been recognized as one of the first hospitals nationally verified in the new Emergency General Surgery Verification Program. We continue to empower and engage our workforce. We are recognized by the American Nurses Credentialing Center for the prestigious Pathway to Excellence designation that shows favorable work environment for our nurses. We also were recognized by Gallup for our unprecedented gains in employee survey. Our commitment to safety, we were the first healthcare system in the nation to go live with the weapons detection software called Zero Eyes. And we continue to leverage our partners. We were recognized by Dallas CEO magazine for our Community Outreach Award for our partnership with the food bank in helping to mitigate some of the food insecurities in our community. And then, of course, many of you were at the groundbreaking ceremony that Cook Children's has with JPS in providing health care in one of the most needed communities, the Las Vegas Trail community. So just wanted to recap last year. With that, do we have another? With that, I'm going to, first of all, I think we have the press release that we did for the hospital explosion. Is that right?
JPS Health Network received notification from our emergency management team that we were to receive patients from an explosion. We received the first patient 20 minutes later and a total of 7 patients throughout the evening. As a 14-year Level 1 trauma center, we had already deployed our incident command system to care for these patients. We had 3 surgeons in the trauma base and were able to take care of these patients in expeditious fashion. 1 patient was transferred to Parkland for major burns, 2 were admitted for their injuries here, and 4 were treated and released. As a veteran Level 1 trauma center, we are always ready. For example, a year or 2 ago, when we had that 133 car pileup we had 7 trauma surgeons here and 13 operating rooms ready to go. I'd like to thank our Fort Worth Police, Fire, and MedStar teams for their outstanding coordination of care, and we were happy to provide them with care packages this afternoon as they are still at the command center. We send our hopes and well wishes to the victims and their families. Thank you very much.
Thanks to Dr. Gandhi for his leadership over trauma and for the team that stands behind him and supports him every day. And then last, I'd just like to, I know Mr. Firestone had asked kind of how do we kind of get our story out there? What kind of marketing, communication do we use? And we're starting to develop that library. And I'm sure that with our next budget, our board will support some additional resources for communicating our story. But this is just one file in our library where our employees really speak to why they come in every day and what motivates them to give the best of care.
In 2023, I think we did very good, ranging from intensive care unit services to pulmonary service, clinics, consult service, and especially interventional pulmonary program.
We performed over 3.7 million tests during 2023, and we did it with a very high rate of accuracy and fantastic turnaround times. We also expanded our molecular microbiology menu substantially, allowing a significantly faster turnaround time for viral diseases for our patients.
We've really stepped up the whole customer service thing. I don't know if anybody really thinks about customer service as a part of healthcare, but it definitely is. So I always try and build that rapport with people to make them comfortable. I think we do a really great job of that.
Starting off robotic navigational bronchoscopy system, the ION system, where we are able to reach, periphery of the lungs and biopsy and early diagnosis of these patients with cancer.
As a family medicine resident, I'm able to take care of literally those that are just born, help them deliver, take care of mom afterwards, and then take care of everyone in between, from young to old. It's been really fulfilling, and it's totally why I went into family medicine, and I love it now.
So something I like that we do is making newborn bags for new mothers. We put diapers, clothes, blankets, and hats. Sometimes we'll put even baby necessities like spoons, whatever they need.
At the end of the day, making our patients leave with a smile, helping them out as much as we can.
We've been able to provide thousands of pounds of food to patients and community members, and that has been a win for us to be able to satisfy that need there for people who are, maybe food insecure.
So I think the biggest 2023 accomplishment for the employee engagement team was our employee engagement survey. I just think that we saw substantial growth in both our score as well as our participation, which is super important because Gallup shows that the more engaged your employees are and the more they feel recognized, right, the more they're going to put back into the organization and they're going to be happier at work.
When our employees are satisfied, our patients are satisfied. And we plan to carry that on to Southwest Medical Home. We just can't wait to get there.
And that's one of our things that we've had for the past couple of years. It's just our committee that not only do we focus on employees, but we focus on our patients as well too.
I am so proud of all of our team members across perioperative services. The patient care that we give day after day to our incredibly sick patients, to our healthy patients that are here for elective cases. We are high volume and we have to be efficient, and our team comes to work day after day dedicated to our goals, which is patient care.
We are very proud of our work in caring for trauma patients, and including their families as well, in connecting them with internal resources and external resources. It's really nice when we can see a patient that has fully recovered and they come back and chat with us. It really pumps us up to know that we did everything that we could to help these patients to continue on with their lives and with their families.
It's been amazing. I think that we have the privilege, right, to work in a place where we try to bring much joy and normalcy
and love to their lives as possible. And so I think that kind of spills over to each other. As we give it to the patients, we also give it to each other.
I think just remembering that we're here for the patients, and that's the whole purpose of being here. We're here for them. Without them, we wouldn't be here.
I think for us moving forward, it's really, really important that we expand the work that we do. And so that's what we'll be working on moving forward. And we're really, really excited to get out into these communities and really do some targeted outreach that we know will make a difference.
We were able to grow and help more patients.
And with that, Mr. Chair, I am finished. Thank you.
Thank you. It's a remarkable amount of work, and you know, we sitting outside, there's an explosion here and a car wreck there. Those things happen every single day, every single hour inside this building, and it's amazing the care that's provided out there. So we really do appreciate that. As far as board chair report, I don't have much to report on other than this year when I hear things out in the community, certainly about things about our board, I want to be able to share them. And I know that Blake and his wife are new grandparents as of early January. Ashton is the name. Healthy boy, they're in Seattle. This kid has a great leg up because his mom is about to be a tax attorney for the IRS, and the baby's dad is literally a rocket scientist working for SpaceX. So congratulations to you all, and enjoy that time with the new grandbaby when you get it. Yeah. Also attached, we don't need approval, but also attached are new board appointments for this year. I just want to let the board members know we kept the size down on the committees on purpose, and to also let you know, any committee member or any board member is welcome to any committee. It's just that the 5 members on each committee are the ones that will vote, but you can go in and certainly deliberate any topic that you see that comes up. That most of this board's work happens in those committees. And I don't want anybody to think that they can't go or be heard, but you're certainly welcome to join. It's just the 5 that are on the committee would be for quorum and for voting. So just want to let you know that. With that, we will move on to Dr. Casey with a report from medical staff.
Chairman.
Oh, yes, sir.
I thought that was a great first run movie.
Oh, thank you.
Yeah, I want to say that was awesome. And I keep asking myself as I was looking at it, how does my neighbor get to know that? I think that's really key for the community to see that. And this, I mean, it was exciting to hear the employees, and you can hear the excitement in their voices as you view that. So I just think that I hope that the board is committed to address budget to enable JPS to get this out.
Yeah, and so in the spirit of J-Lo, we are going to get loud in 2024, and we're going to use this as we go out on the road show. You know, if you want us to be out in the community, anywhere in the community, we will begin to take a lot of this with us because we know it is, and we will add to this also members of our community to talk about JPS because we know it is our employees in our community that are our best PR. And so, thank you.
Any other comments? Dr. Casey?
Thank you, Mr. Chair. The Executive Committee wishes to submit a request for approval for privileges and appointments of the folks listed in your red packets. Yes, sir.
So moved. Motion from Tim and a second from DT. Any further discussion? All in favor? Aye. Motion carries. Thank you, Dr. Casey. All right, we'll move on to, there's no committee reports this month. We'll move to planning. And Mr. Adam? If you will give us a master facility plan construction update, please. It's not like you're doing anything, so.
Morning, everyone. Day. Okay, a lot of progress going on right now, even with the inclement weather. For the PEC, which is just outside the door here, significant progress. We are up to 270 piers drilled out of a total of 306, which means once the cold weather passes us, we'll be able to start forming the foundation and pouring. That's exciting. That means we have a slab moving forward. Steel erection has already started to occur, and most of it is complete for the connector building that connects the PEC to the TSP. So if you get a chance to drop by Jill's office or Dr. Duncan's office, you can look at that out the window. It's pretty significant. And that is another milestone for us that we are going vertical on that project. Next, we have the temporary parking. So we are moving along nicely. As I mentioned before, the holidays, lots D and E are open. Lot C is scheduled to open in March, and Lot B, which is on the campus, which is where the old eligibility center is scheduled to open at the end of February. That's significant because when Lot B opens, then we can start construction on the garage. And so, again, no movements will take place, or we will not start construction until we open these lots. So it's really a domino progression, and we will not interrupt services ever. I want to make that clear. Parking does rule here.
Adam, on the Lot D, what is I mean, it's close enough to the hospital, obviously, where you walk across the street. Are there any plans for traffic control or pedestrian crossing there?
Actually, there's shuttle bus.
Okay, so that Lot D, even though it's next to the hospital,
Lot A
would be
will have shuttle buses, and the patients will be in Lot A. Lot B is for our physicians, and that will be a gated lot specifically for them.
I'm talking about D, where the eligibility center was?
No, that's B.
Oh, B, okay.
Lot C, D, E, and F are up on our South Main properties, up on off of Bryan, north of Rosedale. And primarily, those are overflow for our staff, which we have purchased shuttle buses, and also for contractor parking.
Okay. Yeah, I mean, coming off the hill, there's a lot of traffic coming down there. Right. Thank you.
Then lastly, Southwest Medical Home. Moving along nicely in the construction, as you can see from the photos. We are past steel erection, and now we're actually closing in the building. Wallboard is going on the exterior, and as you can see, interior walls are going up. Just a note for the board, a change to the end date for this project. We have been working diligently with the contractor, and I want to make this very clear. The construction schedule has not changed for this project. Initially, when this project started, we had some delays with acquisition of property and permitting. We've been working with the contractor, and I'd like to give a big kudos to Thomas S. Byrne for working with us, looking to see if they can shave off as much time. We've been holding this back intentionally to see where they could get to at this point. We've been informed there is no more time that can be shaved off, so we had to recognize the change in the schedule at this time. December of this year. We're still within this year.
Actually, I was out there as late as yesterday. And they're about to wrap the whole facility. Yeah.
It's becoming a real building very quickly. It's very nice to see.
It's soon to be a good snow shelter if you don't get a place to stay.
Any more questions?
Thank you.
You bet.
The staffing model for Medical Home Southwest, is that already determined and budgeted, or is that something that we'll exclusively address in this coming budget cycle?
So it is included in the current budget, if that's what you're asking. Yep. Remember that we are relocating Southwest Campus, so a lot of that, there was not as much incremental operational need since we were moving the Southwest Campus into that facility and then expanding.
So we won't see a huge bump in salaries as a result of this project opening, because we're able to just move folks that we're transferring.
Yeah, with very little increase in operational. Yeah.
Great, thank you.
Any other questions? All right. It's the Rory Show. Stanley Show.
While Rory's trying to find the right page, we started our rating agency conversations this week, and I just want to call out Rory for really stepping in and knocking it out of the ballpark in front of the rating. I think we did Fitch this week. Just his confidence in showing JPS's ability to create a great budget, but really to be good stewards of the monies that we receive from local, federal, and then that which we generate. So thank you, Rory.
You're welcome. I had a joke this week. It's kind of like a Senate confirmation hearing in front of those bond rating agencies. So as an organization, we continue to work on financial stability as one of our key strategies. We did kick off in the month of January a key labor component of that financial stability with an engagement looking at our labor costs. Stan has been integral in kind of kicking that off, getting us going with that. We received a bit of good news yesterday from the state, as well as the CMS, and approval of a postpartum Medicaid extension from 2 to 12 months. So that'll be something we had already begun to absorb some of those costs. So we'll see that benefit for those postpartum patients. There are 3 more bond ratings in the next couple of weeks, so we'll wrap that up. Dr. Duncan mentioned me, but she did a tremendous job as well, along with Suzanne Fleming and Shannon. They did a tremendous work preparing for those meetings. So in your packet this month, you have both November and December financials. We will focus on, thanks, I didn't move ahead. We'll focus on December and mostly year-to-date. So all of these numbers have individual slides. So I think what I'm going to do for the sake of time today is just focus on those slides. It'll get us through a little bit quicker. With respect to admissions, you'll see 3 months does make a trend. We are down a little bit, but we are also looking at the way that our budget was spread for those first 3 months. We're going back and looking at that. And so we'll have an update, I think, a better update for you in January on where admissions are at. It's looking like about 7 to 8% year to date, but we're going to take another look at where admissions are trending and kind of why. Occupancy rate, I would just say that if you haven't looked at that as a board member, we calculate that by calculating the number of bed days available as your denominator and your days of care as your numerator. So days of care on top, bed days on bottom, and that percentage is where we run. Just to give you an idea, U.S. average is about 65%, and a good indicator is about 85%. So we run closer to 90%. So we're doing a good job of maximizing our beds, the ones that we have. Case mix, I like to go over case mix because it's kind of a mystery to some people. So today, case mix has been above or right at budget all year. The easiest way to think of case mix is just an index of severity. A 1.0 would be an appendectomy, and a hip replacement would be a 3.0. So that's kind of how we gauge the severity of cases or admissions coming into our facility. So it helps us look at resource utilization and kind of trend why we're up or down in that severity of acuity. Length of stay, really in the month of December, there's a lot of work going on, I would mention, by Dr. Carla Pudi, Jill Farrell, as well as case management, and a number of folks. We're actually in December at 5.75. We look at that year to date, and our target is 5.6 for the year. So we're inching very close to that target. Some of the things they do on a daily basis, just looking at, yesterday was a prime example. We had something like 60 holds in the ED, and by noon, 60 charges, so that we can make room for those patients. So it's physician collaboration as well as case management and a whole host of people, but really want to thank them for working on those objectives. I'll pause. Anything on that first page? Okay. So our outpatient statistics, ED visits continue to be trending upward. We have a significant amount of left without being seen improvement. The CMS benchmark for left without being seen is 3%. We are running 2.1% on our left without being seen. Just to give you an idea, our average for 23 was almost 5. So in that early part of 23, we were closer to that 5%, and now it's down around 2. So that's the work of Jill and Julie Moore, Judd Bryant, those ER people that have really taken that initiative. I like that one because it's also a perception of the community. How does the community perceive us and being able to get to their care in the ED and not sit and wait and leave because they can't be seen. Primary care clinic visits, you can see we're very close to budget. I would say we're not on budget because primarily of a very aggressive goal. We are actually trending above last year this time, but we did set a very aggressive goal, and Dr. Alawe, Joy, and others in community health and Acclaim are really busting at the seams right now. They're a little bit short on providers. They're working extra shifts. They're really doing a good job trying to hit that primary care target, but we do have a very aggressive goal there. Urgent care is slightly below year to date, but it was also a very aggressive target. We continue to try to use urgent care for those more, it's called urgent care for a reason. We want urgency in there, and we don't want medication refills and other things that are not urgent in nature. Specialty clinic, really trending upward all year long. I have actually asked for a little bit of data on this particular slide as to kind of bring back to you, is it orthopedics? Is it neurosurgery? Is it oncology? So I intend to try to give you a little bit more detail behind those specialty clinics and what's driving that. So quick pause there if you have anything. Okay. Surgeries are really 33 cases year to date on the inpatient side within budget. That's about a 2% variance. Outpatient surgery is 88 cases below budget year to date. There's a number of things going on in surgery right now. We did have some operational things that went on in the month of December that caused OR time to be a little bit down, but we also did a great job making up for that lost time. So it's very close is what I would say. I've also asked for an explanation on general surgery, just how you look at the graphs below, and we're very close in most areas, but general surgery is down. So looking at their acuity of patients, it's higher, so we're generating higher acuity. The revenues are equal to what they should be, but we're actually having more acute patients and more what we call CPT codes and just less patients. So you think about it this way, a more severe surgical case takes a little longer, you can't do as many. So that's kind of what that is looking like from a surgical standpoint. We also do have a vascular surgeon vacancy that's going to impact a little bit of our volume as well in the coming months. So. Behavioral health, right on, very close to budget for patient days. A similar story on occupancy rate, very close to that 90% mark. You will look at the PEC in the bottom left there and see a decline. I would just ask you to look to the next slide in the bottom right that we have been doing a lot to try to get people into the clinic. So if you're healthier and being seen in the clinic, you're not in the emergency room. So I wouldn't look at that as a bad indicator. That's a positive thing for our patients. There's also a significant initiative for this year around depression that we are reducing or trying to reduce the depression remission, increased depression remission. So, there were a couple of things in behavioral. We have semi-private rooms in behavioral. When we have a COVID patient or a flu patient, we have to shut down one side of the room. And so that also has impacted a little bit of volume in behavioral health. So those are kind of the statistic highlights. We'll move on to kind of the metric section. I feel like the payer mix is kind of a broken record with respect to where we are trending. We are seeing increased commercial. The purple is where you see that. That's the Cigna Marketplace contract that started in January. Talking to Acclaim this week, they've also been attributed an additional roughly 4,000 members so far in this year. So we're going to continue to see that perform well in commercial. And then Medicaid, the loss of Medicaid for many people coming out of the public health emergency is your green section. And then we did see a little bit of unfavorability in our self-pay inpatient, which is the orange. You see a pretty good jump there from 14 to 20. So I don't think that's a trend. I think we just need to keep a close eye on what's going on with self-pay. FTEs are a little bit above budget, but again, we'll talk about contract labor here in a little bit. We're below in contract labor, so that's mostly the reason we're a little bit above in FTEs. Cash collections are really on target for the first 3 months. It's nice to see that. Sometimes we have a little variability up and down, so we are actually running above 100% for cash year to date. We also did receive CHIRP reimbursement in that first quarter as well that was increased this year. CHIRP, if you're not familiar, is a add-on comprehensive hospital inpatient reimbursement or increase in reimbursement, and that's just more additional funding from the state for Medicaid patients through our managed care organizations. So a little bit of positive in the connection enrollment. This is something we've looked at extensively in the past. We have been working for several months to try to automate the re-enrollment process. So we have finally figured out a way to verify income and actually renew a member at that 1 year mark without having to do a complete re-enrollment to make it easier on the patient. So really December was the first month that's been implemented.
I want to give credit to the team. that they are really making it easy for our patients who are eligible for JPS Connection to stay on JPS Connection. And so thank you, Rory.
Yeah, we'll see that number climb up probably over the next several months, because what typically happened to a patient was they'd be asked to reapply and they just didn't follow through. They would not provide income, not provide a document. So now we've really figured out a way through automation to actually verify that income, and they don't have to submit all these additional documents. So it's going to make it much easier for that process.
Rory, what's the difference between connection and connection supplemental?
Okay, good question. Supplemental really is intended to follow behind primary insurance. So you can still have a job in insurance and still need help paying that portion that you can't pay for. A deductible, for example, might be $5,000. And so you would be eligible based on your income for the Connections program, but you would have primary insurance. And then there's also a supplemental to Medicare that patients are eligible for as well. So by their income level, they can't afford to pay that out of pocket. So we also offer them that same benefit. Instead of assisting them with the entire admission, we're just assisting them with that portion their insurance doesn't cover. Okay. Taking a look at the income statement, as a reminder, we do report these consolidated. I want to really point out a little bit, I mentioned that self-pay revenue in December. That's really why our net patient revenue is down in December, that increase in self-pay. I would like to point out that year-to-date, we're about $3.8 million above net patient revenue, total operating revenues, and about 5 of that, 5.3, is patient revenues. We are adjusting for the DISH component there, that $8 billion cut that was slated to occur in roughly October. That's still tied up in federal legislation, as far as I know. Ashley Quinones has been following that closely for us. We don't have an answer yet on it. There's a possibility that could reverse, and those cuts would not occur. So we're planning for the cut, but we may get a windfall there as a possibility.
Rory, when those cuts, if they do get approved through legislation, will they be retroactive?
Yes, it will be retroactive.
October 1?
Yeah. But that's the purpose of the accounting entry you see there, to kind of plan for that. If we happen to get lucky, we'll have a pickup or a windfall. If we don't, then we've already planned for it, so we won't have to catch up.
Okay, thanks.
I think if you scroll further, you'll see December. Keep scrolling. They're both in there.
Yeah, that's the last.
Okay, here we go. Thank you.
All right. On track?
Yep.
All right. Retail pharmacy continues to be strong. We don't often talk about what retail pharmacy is. Just a quick message about that. If you watch TV, you see Humira, you see Skyrizi, you see Enbrel, you see Rinvoq. All of those are specialty top medications. They are a class of drugs that are biologics that help treat the immune system. So we have our own specialty pharmacy that we grew a couple years ago. Tremendous growth there. And that's really where a lot of that additional pharmacy revenue is right now. It's a good competing segment of our business with a lot of other specialty pharmacies. We can keep our own patients here and not have to redirect them to a CVS or some outside pharmacy. Salaries are just slightly above or unfavorable, right at $190 million for the quarter on a budget of $189. We have market increases coming. We have contract labor that is down, so hopefully all of that by further in the year will kind of normalize. but we do have market increases that are being discussed right now. That's being evaluated, so that will be on the horizon soon. So purchase services are about $9 million favorable. So those are the two expense categories that are favorable. We have projects that are coming online. It's just a timing. We're going to see that expense come on. Other operating expense, I looked at this one just for fun this month because I have nothing else to do. So 1.4 million.
We got different definitions.
On other operating, we're actually $500,000 favorable in recruitment. So Ashley and her team are doing a tremendous job getting recruitment up and running. We may see some of those higher level positions. We'll have some dollars come in recruitment. And then the other $500,000 is in utilities. So we happen to lump circuits bandwidth into utilities, and we've done a good job of turning off circuits that were unused. So we have a lot of savings in that internet expense. So investment incomes are strong. The one thing I'd really like you to take away is revenues are pretty close to budget, and the $16 million that you see that's driving a lot.
I was just thinking of the new medical home and the extent of pharmacy services that we'll have available there. I didn't know if this would extend there or not. This has become a big revenue generator for us. It's a big number. Be something worth looking at.
On the expense item?
There's both. There's the revenue and the expense. So those would offset each other in the financials.
Okay, so the delta would be the profit?
Yeah, really, those patients would have copays, which would be your delta if they have that specialty pharmacy copay. We have a tiered structure for pharmacy copays for Connections members. Most of our patients, though, don't incur a copay. The ones that are on the higher end have a very small copay. Yeah. Okay. Any other questions on the income statement? All right, we'll head to the balance sheet. Running about 175 days, really 177 operating cash. You will note in the board restricted funds, we did grow that fund in December by your approval of the transfer of $150 million. And so that was accounted for in the December financials. You notate the long-term debt in the bond issue down there, the $461 million. One of the things I was looking at and going, why do we have 461? We did 450. I was like, well, we had a little bit, a very small amount of long-term debt before, so very small. So that's the reason. Not other.
Roy, on your comment, you said earlier, you guys have 3 more rating calls in the next 3 days?
We have 3 next week.
So are we, during our rating calls, are we making a point to ask the agencies what their recommended days cash on hand is? Because that's been a topic.
We actually met with Hilltop Christiani.
Hilltop consulted us through that.
Okay.
And they were really saying that the safety mark is 180. But do not go below 150 was what their guidance was.
Okay.
And we have a slide actually where we show where rating Moody's actually shows where to be and then where we're at after we take out that future fund, and we set very close to that.
Yeah, because I think in almost every case, that's a major variable for the rating agencies on any healthcare related debt. Is what's the cash backing it up?
I think that's all they really look at. We have a whole section on days cash on hand.
Good.
And how we compare to other similar hospitals.
Okay,
And so
great. Thank you.
It is the plus, I think, the strength on that presentation.
Okay.
Rory, what's the other accrued liabilities? What makes that up mainly?
You're going to have payroll in there. You're going to have short-term AP. You've got, yeah, I'm going to say payroll, Blake. You do have a separate category for AP there, so that's mostly what that's.
Well, payroll wouldn't be.
You do have some
$580
payroll that you.
million.
Excuse me?
I mean, payroll would be, a pay period accrual at a time, but that's a large number. I'm just wondering what's making that up.
Actually, let me check here. I do have my balance sheet. Hang on just a second. You've got definitely accrued payroll.
That
and
might be the increases. Is that the adjustment? Are we accruing the adjustment?
It's cruel, I think, yeah.
It's actually dropped from the year before.
I mean, I've got a whole host of lists, so we can go offline and look at that.
Yeah, we can talk about that offline.
Yeah, that'll be good. As a reminder, I'll wrap this up, we do report consolidated. There's also a couple of other components, the Acclaim Group and the Foundation. Definitely want to give a shout out to the Acclaim Group, Dr. Alawe, Lori Ching, and various other department chairs. We don't want to neglect to mention the hard work that they're doing as a part of our system, so I want to give them a lot of credit. They're very on budget this year as well. So with that, if there are no questions, we'll take a motion for approval on both November and December financials.
So moved.
Motion by Blake. Second. Second by Zim. Any other conversation? All in favor? Aye. Any opposed? All right, motion passes. Thank you both.
I'll get you an answer.
And Blake, Roy will get with you and on your question about the accrued liabilities. All right.
Thank you.
Appreciate y'all's time. We'll move on to some finance matters, a list of contracts here. First up is, what do we got? We got consider approval to spend on the pharmacy supplier agreement for surgical hemostatic agents between Johnson & Johnson Healthcare Systems and Tarrant County Hospital District. Stanley.
We have two contracts that are pharmacy supplier agreements, if you will, they're seeking your approval for. Both are actually, one is with Baxter, the other is with J&J. They were both awarded contracts really primarily because of their ability to provide hemostatic agents for our patients. From a surgical standpoint, these contracts actually complement each other, as one vendor will have hemostatic product types that the other does not. The Baxter that you will see provides a savings of $147,000 for 7 years, and that includes a 5-year initial term with 2 optional 1-year renewals. And the termination clause tied to that agreement is 120 days. The J&J basically just maintains our GPO pricing and avoids an increase, if you will, due to inflation. It's a Vizient agreement, and that one carries a 90-day out clause from a notice standpoint. So
just if you're wondering, these are items B and C. They were part of the same RFQ, so we can take them as one item with 2 different suppliers.
Move to approve.
Trent has a motion to approve. Reverend has a second. Any other discussion? All in favor?
Aye.
Any opposed? Motion passes. Thank you, Stanley.
thank you.
Next up is consider approval of Amendment 2 to Professional Services Agreement between AGS Healthcare and Tarrant County Hospital District. Mr. Rory.
That we use for contract coding services. This is a agreement that was originally approved in 2020. It was a 3-year agreement with 2 option years. We approved that prior board meeting, and then last year we did not trigger a spending threshold. This year we expect to trigger that spending threshold. This is, I didn't explain it well enough, it's for coding support when we are really lighter in coding staff or unable to hire coding staff. We use this company for that.
Any questions or discussion?
Just a quick comment. Extension, I'm fine, but I think as we go out for an RFP, we should look for for services that doesn't allow to go overseas for coding and stuff like that. So for security and maintaining of the integrity of HIPAA and stuff. But for now, it's an extension, so we've been using it.
That might be something we need to probably discuss, further discussion in staff and maybe in the governance committee.
Do we, I mean, I don't know whether Will or Rory want to speak to kind of the security of the information, because I think that is actually still stays.
I did reach out to AGS this week just to speak to them about their security protocols. I got about a 10-page document that outlines all of their security. The data is hosted domestically, so all of the data is here in the U.S. We can go through a full review of their security protocols with IT. That's something that the security team already does a good job of whenever we contract with any company. So they're assessing that IT security. So we can get together and bring a report back to governance or whatever makes the most sense.
No, I don't have an issue now for extension. Okay. But I'm talking about when we do the RFP and all that stuff. Let's take a look at it.
All right.
Any other discussion? Is there a motion?
Move approval.
I don't know who's first, so I have a motion and a second. Any further discussion? All in favor? Any opposed? All right, motion passes. Thank you. Item E is consider approval of pavilion OR handling equipment proposal between Johnson Controls, Tarrant County Hospital District. Adam.
Hello again. Thank you for the opportunity to present these contracts. So I have 3 contracts. One of them is within the capital budget, routine capital budget. The other 2 are in the facility master plan. So the first one is the ORHU project, which is within the 2024 capital budget. It's a $14 million project. This is for the purchase of the air handling units and all the large chillers that are within this project. This purchase is through our Vizient partner. We're very happy about this, that we held pricing within the budget, which we are not seeing right now within the marketplace. So we're very thankful for that. Again, this has a 30-day notice and it's $2.153 million.
This is replacing equipment that's approximately how old?
From 2008, and it's the rooftop equipment that feeds the ORs within the pavilion.
Okay.
So moved.
Got a motion by Trent. I've got a second. Any further discussion?
A question. Can you explain to me if this does not fit in the excluded category? Was there any other vendors that fit? But I guess I'm trying to look at the best value of this. This vendor did not meet the desired 25%.
Right.
You said, but it says, however, the vendor presented the best overall value.
Right. So Johnson Controls is an equipment supplier, meaning they're a manufacturer of equipment. The large equipment manufacturers don't fall within those categories. So the Stewart and Stevenson, Johnson Controls, et cetera. But this is within what the board approved last year with our purchase agreement with Johnson Controls, because they are the least expensive equipment provider in the nation for these components.
It's the supply, not the.
It's not the install.
Not the
It's just
installing.
the physical equipment itself.
Okay.
Can you expand a little bit on the value of the Vizient GPO and pricing on an existing agreement? How does that work?
Sure. So the Vizient GPO pre-bids a various host of vendors across the board in healthcare and non-healthcare. In this case, they pre-bid equipment suppliers, the York Chillers, Stewart Stevenson, Johnson Controls, et cetera, and they garner the lowest income. They have a host of folks that they have under their umbrella. We send out our RFP to those folks within the Vizient supply chain, and then they provide pricing back to us. And they are locked in their max pricing with previous agreements they have with Vizient that they can ask for their components. Does that make sense?
Can you quantify how much savings we get by working through Vizient?
Since we did not go out to the street in this case, because Vizient guarantees the lowest pricing for us, it's within the Vizient contract, so I can't compare that to what
Can you guess? I mean, are we talking millions a year?
Vizient across the board, tens of millions of dollars a year across,
That we
maybe even
save?
100 million as an organization, not just in our area, it's across the board that we go through Vizient, from gauze to pumps to medical equipment, and we use them, in our division, we use them for engineering, for clinical engineering, all our biomedical equipment, buying through Siemens and Philips and GE. It's significant savings. If we went off to a Philips or GE, we would be roughly at market pricing or just a little less. But through Vizient, because we have bulk purchase, and Vizient isn't just us, it's a whole host of hospitals across the nation, we get the advantages of that bulk purchasing.
So we participate with Vizient. Are we obligated to on every deal we do, or is it we can pick and choose?
No, it's one source for us. But in this case, since we've already been through this process with a number of pieces of equipment, specifically Johnson Controls, we know that's the lowest pricing in the market, and we are seeing this across everything in the facility master plan too. If you recall, last year you approved the Hill-Rom pricing for the replacement of the nurse call system. Again, another Vizient proposal. Far and away, it gave us the vendor we wanted at a much lower price than what was in the market, and that was millions.
Great, thank you.
Any opposed? Item E carries. Thank you, Adam. Item F, consider approval for standard form of agreement between Hoffer Welker LLC and Tarrant County Hospital District.
So the board may recall a couple months ago, we awarded Hoffer Welker the design for the medical outpatient building as selected by recommendation of the Commissioner's Court. We ceded them some money in their contract. It was a base contract until they could figure out the total dollar value of their commitment on this design. That also allowed us to proceed with the design until we resolved these negotiations. We now have the final cost for their services. It's $10.4 million. Again, it has a 10-day out, typical to our design contracts, and this is our standard form contract with the design firm.
Adam, does this one go to the commissioners or is it just us?
It will go to the commissioners because it is construction and design.
Yeah.
But again, they've already approved the firm, so.
They have, and they approved the initial contract. Yeah. So.
All right, I'll ask for a motion.
So move.
Second.
Reverend Emerson, DT, second. All in favor?
Aye.
Any opposed? All right, item F carries. Item G, consider approval design amendment to AIA document A141, 2014 between Beck Architecture LLC and Tarrant County Hospital District.
So last month, you may recall, I mentioned that we are moving forward across all the major projects. Well, this is a piece of that and a significant piece. This is the final cost, negotiated cost for the design of the healthcare towers that we're going to build. Again, this is with Beck. This went all the way through the Commissioner's Court. Commissioner's Court selected Beck. They already are working on design. Again, we preceded them with some money, seeded them with money, and this is the final negotiated cost again. We have the 10-day out convenience with our standard form contract. It is for $49 million out of the $800 million project.
Any discussion?
So just to remind me, so the plan at this point still is that both towers designed simultaneously and that we would be in construction on both towers simultaneously as well?
We are actually vetting out accelerating one of the towers in order to cut out the index
More to
inflation.
come.
A
Yes,
year
we
and a
are
half of index inflation.
Yeah, because I thought we had talked about that,
We
but this
did.
still covers the design.
Absolutely.
Both, okay.
Absolutely.
All right, I'll ask for a motion. Move to approve by Zim, second. I'll get Leonard. Leonard had his hand up. He's not, he and DT, they sit too close, they're too quiet, but I saw Leonard's hand, so. I've got a motion and a second, all in favor?
Aye.
Any opposed? All right, item G is approved. Item H is, thank you, Adam, is consider approval of exemption to bid and the third amendment to the blood service agreement between Carter Blood Care and Tarrant County Hospital District. Is this a two-part deal?
Yes.
Okay. So this is a two-part motion. I know. Hi, Joy.
Happy New Year. All right. Yes, so I'm bringing forward for your consideration and approval of exemption to bid and third amendment to the blood service agreement between Carter Blood Care and the district. Carter Blood Care is the only blood services provider in North Texas that can supply the extensive quantity of blood that we're required to maintain on hand as a level 1 trauma center. And so it's considered sole source. So I'll look to our chair and Daphne, do we need to pause here for this approval, or I'll go ahead and, okay, all right. So and then the second part of this is the third amendment. Essentially what the third amendment allows is a percentage increase for the supply and services for Carter Blood Care at 3%. So actually they'll hold the blood products itself. And that's what's represented here and is approved in our operational FY24 budget.
Any discussion? All right, I'll need a motion on one, the exemption to bid, and two, the amendment.
So moved.
So moved by Tim Davis, second by Zim. All in favor?
Aye.
Any opposition? All right, item H carries. Thank you. All right, item I. This is where I start shaking. IT gets involved. Consider approval of addendum to DIR contract DIR TSO 4167 between General Data Tech LP and Tarrant County Hospital District.
Good morning.
Hi.
All right, so I've got a $5.7 million contract over 5 years of 1.1 annually. This is with General Data Tech, which is GDT, who is a value-added reseller of Cisco. And when you think of Cisco, you can think of all of the network infrastructure, or you can think of the backbone of society, however you want to think about it.
See, this is why I get so nervous.
This is our software and hardware maintenance and technical support contract, and we're trying to accomplish three things. First is we've got the fiscal year 23 hardware that we're bringing on board, and that's part of our refresh program. We've, just as an aside, we've revitalized about 55% of the network, and with this year's purchase of hardware and hard work from my network team, who's done an outstanding job, we'll be at 70%. So the refresh is a big part of this. The second piece is probably the most important. This is a complete redo of the contract so that we're reducing the cost through repackaging of the agreement as a whole. So we're locking in the existing and net new maintenance price terms. And that's important because we've seen about a 20% increase over the last 3 years. We're also locking in equipment cost for the next 2 years. And we're co-terming all the software and maintenance support agreements. And that should give us a cost avoidance of about $121,000 on a yearly basis, or about $607,000 on the cost of the contract. And the last thing we're doing is expanding the overall coverage. We're extending the capabilities with the technical assistance center that Cisco provides so that if we have an issue, we go higher in the queue and get a little bit more support. Any questions? Yes, sir. From a network and from a server perspective.
Well, this contract is for service only. This does not include any hardware, is that correct?
That is correct. I'll be back in a short time for more.
Okay, and that's probably Cisco too?
Yes, sir.
Is there a way why we should not consider expediting it to get it more than 70% of the network switch over at the end?
We have, yes, our limitation is still backlog in terms of the supply chain, getting the equipment, so we're getting as much as we can. And then the second piece is we're trying to time this so that when we start looking at the new data center and the changes going on, that we're timed appropriately. So I don't want to expedite too much and be left holding the bag with all new equipment that I can't work into the overall plan of what we're going to do with the new facilities.
And suppose we're not at risk with some of the patches that they keep it current so that we.
Oh, yes,
okay,
yes,
so
this is a big portion of it. Because it's not just keeping the software that allows the data transfer from point to point, but it's also security components like the identity services engine, ICE, within the switches as well. So there's a security and an operational component that I have to keep up.
Oh, I see. So from a cybersecurity, network security, everything should be in good shape. It's just a matter of more functionality as we.
That's correct, and keeping up with it from here on out.
Okay, got it.
Any other questions?
I just want to make sure everything you just spoke about is item I. It's not item I and J.
No, we're going to get to the next one.
Okay. Just, you speak fast in a language I don't understand, so I just want to make sure that we're, you said both components. All right, so for item I, I'll look for a motion to approve.
Move for approval.
DT?
Yes, sir.
In the second?
Second.
Reverend? All in favor?
Aye.
Any opposed? All right, item I. Passes.
Thank you for the last one. For this one, we're talking GTS, Technology Solutions, not GDT. They're all confusing, but this is GTS. And this is for our firewall refresh. Firewalls are the first line of defense. They're appliances that sit on the network to keep bad stuff from coming into the organization. And again, we do the refresh. This is also a contract that's been renegotiated, so we'll have about a $700K savings.
Well, not bad for a day's work. Any discussion?
And Will, this includes the Palo Alto firewalls. This is hardware and
Yes, this is the
installation?
appliance. Yes. This is the whole gamut. Maintenance, the hardware and maintenance as well.
And you say there's savings over the prior contract?
Yes, sir.
Was that the same vendor?
Yes, sir.
And have we used the same Palo Alto firewalls in the past?
We have them and we're replacing them, yes. And we have Palo Alto certified engineers. Our engineering staff is certified in them.
Oh, okay. So that's like a single source throughout the campus is
Yes, sir.
Palo Alto?
Mhm.
Any further discussion? All right, need a motion?
Move approval.
DT? Second? By Zim, all in favor?
Aye.
Aye.
All right, motion carries.
Thank you very much. See you next month.
Thank you. I'll be sure to take my meds. All right. Well, I appreciate everyone hanging out. The board has some further work to do in closed session for the rest of the day, actually, although Daphne promised to get you out of here by 3 o'clock. So now that's public, so we're holding you to it. Thank you all for attending. This committee will stand we'll take about a 10, 15-minute break, and then we will adjourn into executive session. Thank you.
Making sure that